Hello, it's Doctor of Mind. I'd like to talk about alcohol. As a psychiatrist, I see alcohol on abuse on a daily basis with patients. Alcohol is a body toxin. By the time it gets to the brain, it's already poisoned the body. It's very bad in my view because you can become tolerant, dependent, and ultimately addicted. Then, if you try to stop, you have withdrawals, delirium tremens, and could die of things like seizures. It's actually very dangerous withdrawal. It often requires inpatient hospitalization. Now, if you're drinking to calm down, that's easy to fix. You go see a psychiatrist and get something safer to relax. I've had patients use alcohol for mania. So if you just put them on lithium for their bipolar, they stop drinking and don't die of medical complications of alcohol. That's very easy to treat. The medical complications of alcohol are also bad. I remember a patient bleeding to death right in front of me. I couldn't get the tube down his esophagus and blow up the balloon to stop the hemorrhagic blood, and he just kept vomiting blood and just died right in front of me. I'll never forget that. There's unappreciated cardiac toxic effects. It's cardiotoxic. If you keep getting withdrawals, you'll get hypertension, tachycardia, causes cardiomyopathy, congestive heart failure. It's very dangerous if you have cardiac side effects from alcohol. The liver, causes acute fatty liver and then shrunk, scarred, cirrhotic liver. Liver's important because it metabolizes other medications. Now, drinking on antidepressants basically inactivates the antidepressant. So you really need to see a specialist to get the right type of treatment for depression if you also are drinking, because that's very complicated to treat. Now, when you mix alcohol with stimulants like cocaine and meth, the alcohol masks the pain of the coronary artery spasm from the cocaine, and you just drop dead. So, alcohol and stimulants is a very severe warning sign to get help. It's very, very dangerous. That's the most dangerous mixture, in my opinion, alcohol and stimulants. You can't just stop alcohol if you're dependent. You have to go in and get a benzodiazepine taper on multivitamin supplementation, treatment for your other medical and psychiatric conditions. Now, there's good meds for alcoholism. Antabuse, remember that one? It makes you vomit if you drink. That's getting a little outdated, but it's still requested by some patients. Then you have naltrexone, which is a opiate antagonist in both generic oral form, 50 milligram in the morning, or the expensive monthly injectable version. There's also acamprosate, 333 milligram capsules 2-3 times a day. That's a lot of pills, but many patients like that one too. So there's actually medicine for alcoholism. Of course, psychosocial rehab's important. I like AA. Rehab programs, maybe up to 6 months, can be useful for patients. And really, you should try to get off this early in your life because it's just devastating. Have you seen Patients who are alcoholics, look at that, what's happened to their body and mind. It essentially pickles the body and mind. You're much safer off if you want something to numb your emotional pain, to go to a psychiatrist and get a tranquilizer, whatever is wrong, that's diagnosed and treated properly with supervision, that goes directly to the brain instead of poisoning the whole body first and then going to the brain. Please get help for alcoholism. It's a life-threatening illness, because if you stop, you go into delirium tremens 48 to 72 hours later, seizure, and die. You wouldn't think that that could happen. I don't really believe in drinking to decrease stress. If you have a half a glass of wine occasionally, whatever, but I'm talking about alcohol abuse and dependence in the classic sense. Good luck.